So, welcome everyone. We are very excited about this partnership with Glenn, with Plain Simple, because, and he's going to talk to you about it. It addresses an unmet need in the creative industry, and I've known Glenn for some time. He was a film producer back in the day when making beautiful TV commercials, and had sort of ventured off into the world of financial planning and kind of, I think, Glenn, you'll talk about it, but has been quite determined to do something of this nature, because you've obviously seen that a lot of people in the industry don't have this kind of cover. So the ability for freelancers and for small agencies who don't have these kind of group schemes and aren't able to access them is something that this program aims to solve. So we're excited about it. And Glenn, I'm going to hand over to you, and you can talk about it. And then I think we knew it was going to be a smallish group, so we are very happy to make this very interactive. Ask as many questions as you like. Tell Glenn what interests you about this, what you want to know, and yeah, let's just make it a good conversation. Glenn, over to you.
Fantastic, Gillian. Thanks for the intro. Hi, everybody. I know one or two of you, and some of you I don't, and I hope to engage with you in the near future. So just very briefly, I worked in the advertising industry as a producer for many years, and I had my own production company, and then kind of freelanced for a while. But in my tenure in industry, I served on the exco of the CPA for many years, and insurance was always a problem, not because it wasn't available, but because it was affordable. Healthcare wasn't really available, and if you think about it, freelancers are pretty much a wild bunch. When they've got money, it's party time and let's spend it, and when they don't have money, then we're a pitiful kind of lot. But there was always a definite identifier of the requirement of something affordable, and every time, the barrier that we ran into was the fact that there was never an employer-employee situation. Certainly not amongst the masses of freelancers and gig workers, and if you look at the cross section of those people through advertising and film and entertainment in general, it's a big demographic. So when I got into this world in 2022 by default, but I'm very happy to be here. I obviously had to do a lot of accreditation and studying, etc. I'm mostly on top of all of that now, but I still keep in touch with the agency. I'm still a consultant to a Cincinnati company who plays consultants around the world to do cost and brand protection on big productions. So my interest in the industry is still very much there, and there was a guy a couple of years ago trying to get something going, and he started off at new product development because everybody thought that the industry needed something very new. He unfortunately died, and when I met with I had a meeting with the CPA early last year, and they suggested that if I wanted to, I should maybe try and pick up where he left off, which I did, and it soon became evident that anything that he had been working on was years away from reaching any form of success. So I started approaching people that sell health products, and there aren't many that are very good. but we ended up negotiating with Momentum, who were prepared to give us an ear, and we had to find a legal way to take on the administrative duties of the employer, because anybody that wants to get onto the scheme, the employer needs to pay the debit order to the product supplier. That's one of the compliance requirements of any group benefit. So we eventually, through legal consultation and through consultation with Momentum, we set up the Plain Simple Association. It's a non-profit organization, and anybody that is prepared to become a member of the Plain Simple Association can effectively take on and get group rates for health insurance, okay, which is discountable on a group level, whereas medical aid, and I'll explain the difference, is not discountable. The only people that discount medical aids are big corporations that have their own medical schemes. So, for instance, the government has the government employee medical fund, GEMS, and they can, with their actuaries, they can determine their own rates. But you have something and somebody just raise your hand when I'm boring you, but I just think there's some detail that we should all understand. You have something called the prescribed minimum benefits, and the medical schemes, or the Medical Board of South Africa says if you want to run a medical aid, you have to prescribe to the PMBs. There are 270 of them, which include 26 chronic diseases. And should any of your members fall ill as a result, or that of a disease, an accident, whatever, that falls into the PMBs, you have to take care of them. And you can determine how you're going to take care of them, where you're going to take care of them, but you have to take care of them until they are better or until they die. So, for instance, if a guy gets testicular cancer or colon cancer, and he belongs to a medical aid like Discovery or Momentum or Camisa, whoever, that medical aid has to look after him and pay the oncology, pay the private hospital, which can be a private hospital of their choice. And if that costs 2 or 3 million rand, then that's what it costs. There is no ceiling to what that procedural care could cost. Whereas with health insurance is more like car insurance or household insurance. You get what you pay for. Okay, so they do not prescribe to the PMBs. So if you take health insurance, you know that if you're covered for accident and emergency, you can go to any private hospital, and you have 30,000 rand for emergency cover, and you have 300,000 rand for hospital care. After that, if you are not better, then you either pay yourself, or they will put you into the best public facility available for whatever your medical condition is. So that's primarily the difference. We Plain Simple has negotiated on Health for Me, which is health insurance. Woolworths are on the same scheme. A couple of mines are on the same scheme. So it's very, very based on a lot of research that I did. We believe it is the best health insurance available in the country at the moment. And because we're not a big employer like Woolworths, we've had to package our bronze offering and our silver offering and our gold offering as not negotiable. So if you take bronze, then the bronze is what it is, and you can see that on the website. If you take silver, it is what it is. If you take gold, it is what it is. If you were working for Woolworths, you could take gold, and you could maybe add on a few little additional benefits. We have added in the benefits that we believe are the most needed, which is a funeral policy, emergency and accident, and an emergency and accident booster, which gives you cover for about 11 medical procedures like kidney stones, asthma attacks. There are quite a few that should any of those happen to you, you are automatically covered to go into hospital and to be taken care of. And so that is really where we are. The saving is huge. You know, our gold package is 540 Rand a month, and I'm just going to focus on that at the moment because it's the most effective. It covers all the potential benefits that are available. And if you were to pay as a man on the street for the same cover, it would cost you double. So you'd be in for 1,080, you know, to get the same benefits. And so as a non-member, it's just not available to you because it's a group offering. And as a member, you're effectively saving a lot of money. It's aimed, I'm not telling you that it's at all better than a medical aid. If you can afford medical aid, you know, take medical aid because the prescribed minimum benefits, diseases, cancers, you know, all those horrendous things that can really drag you down and plague you for years will fall under the prescribed minimum benefits. Have we got a possible solution to that? Yes, there are hospital plans available. So you could take, we have sold to some people who have decided to invest with us. They have taken gold, and then they've taken a hospital plan called FlexiFed, which is with Fed Health, that costs them 1,000 Rand a month, and the hospital plans prescribe to the PMBs. So should you get one of the PMB cancers, a stroke that debilitates you for a year or two or whatever, and you're in hospital for months, then the hospital plan has to cover you. Okay. And so what you don't get with the hospital plans is good day-to-day care, and the Health for Me is exceptionally good day-to-day care. The drawback of the doctor availability, which is 24/7, is they are network doctors. Okay, so it's not like you build up a relationship with a doctor on the network, because they are recycled all the time. They move towns, they move areas, they move suburbs. They come onto the scheme, they go off the scheme, they immigrate, they semigrate. So it's the convenience. You are paying for the convenience of having a doctor available 24/7, either via telephone or via video call, or you have 3 visits, in-room visits a year that are part of your package. And if you phone in and if your child is on the same scheme with you, and your child is, you know, bursting out in a fever and full of spots at 2 o'clock in the morning, and the doctor sees, oh, wow, this kid's ill, he's going to say, you know, take your child to hospital or come into the rooms or whatever. And that is then obviously covered. So to cut a long story short, it's for people who have no medical cover currently and who need something. And in our current state of affairs in our country, I think everybody needs something. You know, I think I can't talk about the advertising industry, but certainly in the film industry, there have been so many cases of technicians that have been injured on duty, off duty, wherever the case might be, and have become temporarily or permanently disabled, or have died and have had absolutely no cover, nothing whatsoever. They leave behind a husband with 2 little babies, or they leave behind a wife or a girlfriend with 2 babies, and there's nothing to look after them. Whereas if they had even just the medical part of what we offer, there would at least be a really basic little funeral policy. If they had the income protection, we've managed to negotiate that which only covers you for 6 months. It's a very basic income protection plan, but we've managed to negotiate that you can if you die, whatever level you've insured at your income, 6 times that will be paid out as a death benefit. So that could be 200,000 or 300,000 rand paid to your surviving partner or child or mother or father, whatever, which is better than a kick up the butt, And I think that's really, as much as I want to tell you right now, it's quite a breakthrough for us. I'm going to be completely honest. The film technicians have not rushed at it, but they never have. It's been a tough year. I think in general, a lot of you might agree that the financial sector hasn't been our best friend for the last 30 years. Anybody without a pay slip, a lot of you will have experience with this. If you wanted a bond, or you wanted a business loan, or you wanted car financing, it was a bitch. It was a bitch to get anything unless you were prepared to put down huge deposits and things like that. It is changing, but I think there is, as a result of that, I think there is a mental block with people. The minute you go, here's an insurance offering, or everyone goes like, and it's going to take a while for people to realize that actually it's extremely good value for money, as opposed to, I'm a type 1 diabetic. I'm on Discovery Chronic, and my medical aid costs me 8,000 rand a month. It's like ludicrous, but I can't afford to be without it. But if I didn't have it, I would certainly want to get onto the scheme here, because medical aids cannot refuse taking you on, nor can health insurance, and especially if you're part of a group scheme like this. All they can do is they can give you waiting periods for pre-existing conditions. So it's a very easy process. You just have to sign up. Gillian can tell you about the membership fees that I think the ACA are covering for new members, for new signups, and then you pay whichever product we have, on offer. Long term down the line, I would love to have a strong enough membership that we can start trying to find provident schemes and people like that, people that would back us and say, okay, if you've got solid members that have been with you for 2 years or more, here's a provident scheme that we can put together, so that we can start educating people slowly about the importance of financial well-being, because it's crucial. So that's me for now. I think I certainly want to open it up to any questions. I can put the website up if anybody would like to see
I think
anything,
should,
but
Glenn, because I actually just gone onto it now, and it summarizes, it shows the different buckets quite nicely. So maybe just put it up, because you've got your different buckets. You've got your, where's mine gone now? So it's plainsimple.coza for anyone who wants to look. So you've got your health insurance that you've spoken through. You've got your income protection, which is just, I think, so critical, especially seeing as a lot of people in this area are the only income generator in the family or whatever, and then something happens, and the film industry is quite tight at the moment, I know, but I mean, something happens in you have an injury or something and you can't actually service your clients, it's quite terrifying.
Yeah,
So
I think for any freelancer, for any gig work or whatever, these are the two most important things you need to ensure, because you are your own asset. You know, you are your own bottle of Coca-Cola that you're selling, and if you become sick or if you break both your legs, you can't earn. You know, and the first thing to understand about financial wealth is that if you have saved for a rainy day, which you should, and you can't work for 3 months, you don't want to use that money necessarily to pay your bond and your rent and your school fees. You know, if you can have income protection, that will take care of that for you. You know, for not a very, very big investment. So, and the other benefit that my partners in this are ProTax. They are extremely good at tax advice, financial advice, estate planning, etc., etc. I work both sides of the fence. So that is our third offering, you know, at this stage. But we, you know, if you just want to navigate the website, you go to Momentum. You can go to see all the health offerings, and it tells you about a little bit about a few of the benefits. It tells you that funeral cover is included as well. You then can go and have a look at the bronze. That's your entry level, which is pretty basic, but you've still got 24/7 doctor availability. You've still got 3 visits. The primary differences are bronze. You don't get any dentistry, you don't get any optometry, and you don't get any specialist visits. All right. Silver, you get dentistry, basic dentistry, fillings, extractions, infections, teeth cleaning once a year, and you get specialists. Okay. And gold, you get all of it. And as I said, all of them carry the emergency and accident cover, and the funeral cover and the emergency benefit, which I think in anybody's life, those are really crucial things to have. So you can go and view the details, which I'm not going to take you through right now, but they're all there for each of the silos. If you want to apply, you can just click on the apply. You can download the form, and fill it in and send it back to us. And if you want, that gives you all your rates. So your main members, Gillian and her spouse, would pay the same amount. The child is under 18, under 26 if they're still being educated. You get the child rates. And on gold, your child rate is very favorable because it's down to 292. And then it just gives you a few examples of what you would be paying. For instance, on the gold package, I'm just going to try. I'm sure you can all see it. I can't. I can't get this out the way. Sorry. So it gives you an example of what you would pay for a member and a spouse, a member and a spouse and 1 child, and a member and a spouse and 2 children. There's frequently asked questions, and the income protection. I'm just going to show you very basically. Gives you levels of how to get levels of income, and that should be based on what you can justify. So at the time of any claim, you have to be able to prove your previous 12 months of earnings, that you have in fact been earning between 50 to 75,000 Rand a month. Right. If you've only been earning 25 to 35, then only insure for that. You know, really just make sure that you insure to cover your absolute basic needs. You have payment methods. You can choose a monthly debit, you can choose a 6-month debit, or you can choose annual. For all the freelancers, obviously, we encourage that everybody, even for the medical benefit, that everybody tries to pay at least 6 months or a year in advance, because it takes away the stress of the monthly dreaded debit order that's going to go off the account, and it gives you a little bit of additional peace of mind that at least for the next 12 months or 6 months you're covered. Some people have shown interest in taking cover for 1 or 2 of their employees, and they're quite happy to pay for a year upfront and just get it out the way, you know.
And
and
so,
yes, ma'am.
okay, sorry, can I just ask, you've set this up specifically for film, entertainment, advertising community, right?
Absolutely. Yeah. It's the only way we could in legally, for a non-profit organization to offer benefits to its members.
Mm-hmm.
It has to target a very specific area of industry,
Right.
or area of sport or entertainment, or whatever the case might be. And that has to be very clearly stipulated in your memorandum of incorporation. And that is how we created the compliant route for us to be able to offer this, because the association takes on the administrative and compliant adherence requirements of what the employee would do.
Right.
So we, for the Health for Me Momentum product, we have to collect all the debit orders.
Right.
Okay, and we can collect them annually or whatever, and we manage that. We've got a payroll department here who are extremely effective, and we then have to pay Momentum every month the declared premium for that month. Okay, once we pay them, and once you are loaded onto the portal, they then take over dealing with you as the individual.
Right.
They issue you your policy. They issue you your little medical aid card, which is a little digital card, and you will handle claims and things directly with Health for Me. We then take over as the broker on your business, and should you have any issues or problems or complaints, I take that up, you know, and I go fight it on your behalf.
And so the people who want this need to be a member of your association in order to get it.
That's right.
And that membership fee was what, 400 Rand, if I'm right? What was it?
Yeah. Gold is 540.
Okay.
Silver is 461, and bronze entry level is 397.
Okay, but is that the association membership fee, or is that the plan?
No, the association membership fee is 400 Rand a year.
Okay, great. So just so for the people on the call, you can go straight to Glenn. You can go straight to Plain Simple, pay the association fee and do it directly. Alternatively, what the partnership with the ACA is saying, if you sign up as a member of the ACA and you pay our membership fee, we will pay your portion. We will pay your membership fee over to Glenn. So in that way, you'll get membership of ACA and Plain Simple, or you can just go to Plain Simple. So I just want to put that out there as well. I see Bongi's got a question.
Yes, morning. I wanted to, regarding the membership fee, is it 400 per year for an individual or as a company?
It's per individual.
Per individual. And then is there a minimum number of employees that are required to register, or?
No, not at all.
Okay.
Not at all.
Thanks.
In fact, Bongi, if you have a company that has 5 employees or more, and you would prefer us to register you with your own portal, where you handle your own payments because you're running payroll for your company. We can run your payroll for you if you want. I'm just advertising a little bit. But you can have your own portal with Momentum that we can set up for you. Or alternatively, if you only want to put 2 or 3 people on it, you can absolutely run it through us, and we will then collect the debit order from you, and we will pay it over on behalf of all the 2 or 3 or 1 member, whatever the case might be.
Yeah. So initially we were very excited about it just from an individual point of view. The ACA currently doesn't have a huge amount of individual members, but we are trying to grow that. But then we realized that actually a lot of small businesses, this could be a solve, possibly. So, yeah.
Thank
Palesa,
you.
sure, no problem. Palesa, your hand's up.
Hi guys, sorry. I also just jumped on just a little bit late, but I wanted to find out, is this something that only organizations can sign up for? Or for example, I work for an entertainment company, but the plan is suitable for me. Am I able to just do it on my own capacity?
Yeah, absolutely. Sure, of course.
Awesome.
I think as Gillian just mentioned, it's aimed at the individual, but it's available to smaller agencies, to medium-sized agencies as well. I think probably generally the larger agencies tend to have their own employee benefit schemes.
Yeah.
But I know a lot of them don't offer any medical kind of products. So their people can speak to us directly.
Yeah. But even if it is through a small business, the individuals would still need to be registered. Right.
Yeah. Every person that's receiving the benefit needs to be a member of the association.
Yeah. Okay.
Quite
Awesome.
Right.
So any other questions? I mean, I think is there anything else like this in the market? I mean, I find it quite confusing to look at all the options and find it. So I think what you've done also, Glenn, that I appreciate is you've done the comparisons. You've gone and had a look at all of them, and you've said which is the best option in this, because I think, as you say, the financial industries, love to confuse us. So I think it's a really nice shortcut as well, having had you do the hard work.
Yeah, I think it was one of those things that somebody was going to have to take it on at some other stage and just grab the bull by the horns and try and find a solution. I'm not saying that this is the sort of holy shrine of where we want to be, but it's a good start. I think it's a damn fine product. I think it's a very good price for what you're getting, and certainly as we grow in numbers, we can start negotiating with other people as well, because it is a business. It's going to take a long time before it makes any kind of return for us, but hopefully in 5 years' time it'll be doing that. But really for me, the what I like about it is that it creates an association for such a broad demographic of people who normally are so competitive, and so suddenly you have musicians and grips and strategists and copywriters and who can all be on the same platform. We do want to start once we getting a slight kind of income from the business, perhaps a little animation series, very basic, that just every week puts out a little financial tip. Because I know certainly when I was 20 and 25 starting off in this industry, no one was interested in my financial well-being, at all.
Yeah.
I earned $150 a week and I spent it at the pub on a Friday night. That was that was it. And had I known then that if I'd put 100 Rand a week away, it would have been worth 26 million today, you know, it would have been
Yeah.
great. But
Don't
but
look back.
if we can start helping people, you know, with that, just to get a basic understanding, you know, there are a lot of people in this industry sphere that really don't understand money, you know, and how to manage it properly, and it is quite for our needs. I think there's a requirement
I think I
for
see
that.
Sharon's hands up, but I also just want to say I think it is also an industry where, you know, a lot of people are, and that's what interesting you say about paying it all up front, because a lot of it is hand to mouth and there's not always projects available, and sometimes the projects are delayed and sometimes they get cancelled. You know, so it is a difficult one to navigate. Sharon?
Sure.
Yeah, Glenn, I was just wondering whether you could investigate a retrenchment option. I know a lot of insurers provide retrenchment insurance, and I know it's capped at around 35,000. But I think for our smaller agencies, or also even employees in bigger agencies, don't think about this retrenchment benefit. They can get it. You can get it through Old Mutual and companies like that. But I think that might also be something that you could look at adding, which I think may attract a lot of people, because people don't know about that they can have a retrenchment benefit that will cover that cover retrenchment, and even though I know it is capped.
Yeah, Sharon, just to answer you quickly, it does exist. It falls under the Long-Term Insurance Act, and it has to be linked generally to a life insurance policy. Okay, so you can take out with Liberty Life, for instance, you can take out a 2 million Rand life policy, and you can have an income protection add on that policy, and linked to that you can have retrenchment. Okay, and like anything, there are requirements. Okay, you have to have been with the employer for longer than 12 months. Okay, 12 months or more, etc., etc. So at the moment, sure, we have access to all those products. Okay, we sell life cover. We really cover most of what is required. Professional indemnity, I'm looking into for the estate agents at the moment. But to get any form of retrenchment for freelancers, there isn't really currently a claim process. You know, it would probably have to be a standalone policy, and it's complicated. There's a lot of fiduciary requirement that goes into it, and I will look into it. But until we have 1,000 people, nobody's going to talk to me about that, you know.
Yeah, so I wasn't really looking at it from a point of view of freelancers. I get that. But I was looking at the broader agency employee that actually has some kinds of benefit. That is there a policy, if we got the numbers, that employees in agencies could sign up for in terms of numbers, that would give them the life insurance that is linked to a retrenchment benefit. I do realize freelancers can't get that.
Yeah. So sorry to interrupt you. Normally in your bigger agencies or your bigger companies, if you take something like Old Mutual, they have a very good provident scheme called the Super Fund. And when you sign on X amount of employees, you automatically, because you're making certain contributions towards their retirement, you get what's called unapproved life cover, okay? Which means that Sharon and Gillian and Glenn, because of their income levels and blah, 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 are each pre-approved, no underwriting required for, let's hypothetically say 800,000 Rand, okay? And 75% of our income is we have income protection for 6 months, or whatever. And you can add to that, you can add a retrenchment. So those schemes are available. They group schemes. They're part of employee benefit schemes in the bigger companies. And I say bigger companies, generally you need 10 people or more to involve and engage a provident scheme like that. So I hear you. I hear you. It's not. It also touches on UIF. A lot of people pay UIF at the moment, and UIF is structured in such a way to look after people when they lose their jobs or become retrenched. And just to be clear, there's no insurance that will cover you if you're just sitting without a job. If you haven't been retrenched and there's no work for you because nobody is kind of bashing down your door to employ you as a copywriter, well, bad luck, or nobody's bashing down your door to employ you as a guitarist or a cameraman or a strategist, well, bad luck. But there are insurances, and what I'm trying to identify initially is affordable stuff for the high risk areas of our lives, and that's where we're starting off. And the retrenchment is a very, very real thing, and it's a global thing. But it's not something I'm chasing right now, but I am saying that there are products available. There are products available to the individual, and there are products available to companies as well, who want to maybe think of taking something like the super fund for their company. So we can certainly talk about things like that, but I will look into it, and I think it's a great suggestion. Thank you.
Great. Any other questions? We've got 10 minutes. Does this sound like something that is interesting to you for those of you on a call? Glenn, do you want to maybe take your website off so we can see people's, or your screen share? Sorry, take your screen share off. There we go. Now I can see me. Oh. I think if you just, there we go. Great. I mean, I think Palesa.
So this is me just asking, how can we sign up and how do we get started?
So simply, my website, my email address, Palesa, is Glenn
At Plain Simple.
at plainsimple.co.za.
Awesome.
Send me your details and tell me what you're interested in, and I can give you a call and we can have a chat. And I'm not sure if you're an ACA member or not an ACA member, so those details you can sort out with Gillian. But
yes, I'm not a member. I'm not a member of anything at the moment.
Okay.
We run a small talent management agency, and one of our stakeholders sent us a link, and I was like, oh my God, really want to check this out. So
Right.
I just came in when you were showing the packages, the bronze, gold, and silver and gold.
Okay.
So I just would like to see maybe what you presented before. Are you guys going to maybe send us a booklet on email or something, or the recording, so I can just go back? But I'm definitely keen. And Then I'll know more of the membership thing, and do I
Mhm.
have to do the ACA or individually? So yeah, I just jumped on the wagon right now.
It's up to you. We'll send you the recording, but I think speak to Glenn directly.
Okay, perfect.
The ACA options, so you can sign up directly with Glenn. If you want. If you also want to be a member of the ACA and come to our events and seminars and get all of that additional benefit, you join us, and then we pay your membership to Plain Simple. But that's a choice for you.
Awesome. I'm looking forward to.
I'm glad you're excited. That sounds.
I really am. I'm looking forward to a whole lot more information, but then I'll definitely email you, Glenn.
Awesome.
Yeah, pop in a mail, give me your phone number, and I'll give you a buzz, and we can set up a
Awesome.
Teams or something and pick it up from there.
Great.
Thank you.
Great.
Thank you so much. I'm
It's a
just gonna
pleasure.
jump off. I have a status meeting now at 12, but
No
thank you so
problem.
much for this.
Okay.
Tell them about us.
Listen, I feel like I'm putting this on my WhatsApp status, Instagram, Twitter, everywhere.
Good.
Thank you so much.
I'm glad
Thank
you're as
you.
excited as we are. That's great.
All right. Thank
Bye.
you. Bye.
Hi, Glenn. Nice to see you.
Hi, Paul. How's it?
Oh,
How's it
how are you?
starting? Good, thanks. Well done. This is really
Fantastic.
good.
Thank you.
I've got a management meeting tomorrow, so I'll talk to Tembi, our FD,
Mm-hmm.
and yeah, I'll just give her the link and try and set up a meeting with you and her, or just, yeah, it's really good. So well done. It's
Thank you.
needed. It's
Thank you.
definitely
Great.
needed.
You
Nothing
mean I
else
might
to
get
say.
to meet Tembi eventually?
Yeah. So yeah. So
Yeah.
let's
Yeah.
I'll definitely, it's on my agenda for tomorrow, and I understand
Wonderful.
it more now, but there's nothing else like it, and it is needed.
Mhm.
It's
Yeah.
just whether people want the beers at the end of the week, or whether they want the 26 bar at the end of 30 years. So
Yeah.
There we go.
And,
There we go.
and their teeth cleaned. Yeah.
yeah. So it
Um,
might be interesting. I just thought, to at the schools, if you could, all the most of the good people go through one of the schools.
yeah.
You have a 10-15 minutes there at the school, so that you embed it in their head before they get into the industry. That would
Yeah.
be good.
It's
'Cause-
not that simple. I
No,
tried.
no.
I tried with AFTA.
Mhm.
And they were going to invite me to one or two of their events, and I asked them if I could go put up, posters in Cape Town and Joburg, and it was like trying to bash down the wall,
Really.
No.
So if you and there are so many, that I would love to go do a little talk at. If you can maybe open a few doors for me, Paul, I'd be very grateful.
Because I find that every young person that I spend time with them, they're missing all the normal stuff.
Yeah.
They're missing how to be in an agency, what to do, what not to do, and also the life, how to treat the money, and how to really grow the money, and how to be fit and healthy. So
Sure.
they're missing all that stuff.
Yeah.
Yeah, good.
Yeah.
But
Great.
Fantastic.
Excellent.
I'll be in contact. Thank you.
Great. Lovely.
Pleasure.
Okay.
Thanks, Paul.
Thank you.
Awesome. Well, thanks, Glenn. I think
Julian, thank you so much.